Hello, Slim and I are back again to talk to you about advanced treatment of joint pains. You may remember from an earlier video that we use injections to specifically diagnose and try to treat certain pains coming from joints, such as the sacroiliac joint down in here, the lumbar facet joints here in green, the thoracic facet joints demonstrated here in blue, and sometimes up in the neck, the cervical facet joints in purple. Sometimes after such an injection, we are able to learn that the pain is coming from one or several specific joints, but after one or two attempts, we also learn that the best we can do with injection is perhaps a few hours or maybe a day or two of relief at the most. And so we typically in that circumstance move on to what I refer to as Plan B. Plan B is the application of what I describe as high energy to those specific locations in order to disrupt the pain that's coming from the joint before it has an opportunity to get to the spinal cord and then up to the brain where it's felt as pain. There are different names for this technique. Some people call it radio frequency. I think of it more as a glorified electrocautery. Some people refer to it as a denervation, but personally I think that word can be a little bit misleading. The idea, however, is that a specially designed needle or needles are advanced to specific locations. For example, with the sacroiliac joint, there are 4 locations, here, 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 and here, that are located just outside of the joint. For the lumbar facet joints, there are 2 locations for each joint, here and here, above and below this joint, for example. In the thoracic spine, it's a similar idea, placed just below and above each joint. And similarly in the neck, again, 2 locations to treat one joint, or sometimes 3 locations to treat 2 adjacent joints. The idea is that this is performed under a small amount of sedation. Trying to do this with no sedation at all can be very uncomfortable for a patient. So typically a little bit of sedation works better, but not enough to make a patient fall asleep. The reason, of course, is that communication between the patient and the physician is essential to assure safety of the procedure. The procedure typically takes a little bit longer than a simple injection. One can expect to be laying on a procedure table for about 30 minutes on the average for one of these techniques. Also, it should be understood that a technique of high energy applied to the spine is going to be a bit more uncomfortable than a simple injection. And that's part of the reason for the sedation. It can also be expected that for 2 or 3 weeks after such a procedure, there would be a bit more pain in that location as the healing progresses. Healing typically takes between 3 and 4 weeks, and that's the point at which one might normally reevaluate the response to this procedure. This technique of applying high energy to relieve spinal pain was developed in the mid-1970s, and over the next 20 to 30 years has become quite commonplace in interventional pain management practices. So it has a very long record of both safety and efficacy. Now, one can expect that about 60 to 70% of patients that receive this procedure would get relief of 1/2 or more than 1/2 of their pain, and that it would last anywhere between 6 and 18 months. If and when such pain returns, certainly a reevaluation would be performed in the office, and then usually repeat of the diagnostic injections would be performed in order to make certain of the exact location of the pain. And this could be followed by a repeat of the radiofrequency or high energy treatment. Thank you.